Hello everyone, it's me Dr. Ayaz Ahmed. I am working as an aesthetic dermatologist. Today I will discuss another important topic of dermatology. The name of topic is clinical variants of leprosy. Hopefully you will learn and subscribe my YouTube channel. The number first clinical variant is the tuberculoid leprosy. In this clinical variants, only skin and nerve show clinical evidence of disease. Lesions are few and solitary. Features are nerve pain first, followed by anesthesia, muscle weakness, and wasting. Typical lesion is purple or copper color erythematous block with raised and clear cut edges, sloping towards flattened and hypopigmented center. This picture describes the appearance of plaque in case of tuberculoid leprosy. The plaques are well defined and erythematous with clear cut edges. The direction of edges is towards flattened hypopigmented center. I will show you in next picture. This is another example of tuberculoid leprosy. Now you can see the direction of sloping of plaque towards hypopigmented center. The edges are well defined and the plaque is erythematous. Another type is the lepromatous leprosy. First, clinical presentations are usually dermal. Moreover, nerve involvement is asymptomatic and ignored by the patient. Patients usually complain of nasal stiffness, discharge, epistaxis, edema of leg and ankle, macule, diffuse papule, infiltration, nodule. Macules are small, multiple, erythematous, faintly hypopigmented with shiny surface. Moreover, nodules have normal skin, but they may also be erythematous with bilateral symmetrical distribution on face, arm, and legs, and also buttocks, except hairy scalp, axilla, gorion, and perineum. In polar lepromatous leprosy, diffuse infiltration and gradual thickening of dermis may precede nodulation by months or years. Papules on lips and nodules on palate, vulva, tongue, and gums may be noted. Nodule may perforate and epistaxis is also observed. Numbness and anesthesia of dorsum of hand and feet, followed by extensors of arm and leg, and finally trunks are noted. Corneal involvement, corneal nerve involvement may lead to injury, infection, blindness. Swelling and edema of hand and feet are noted. X-rays show osteoporosis in phalanx, osteolytic cyst and compression fracture. Fingers are crooked or short, nails are thin and brittle. In untreated patient, lines of forehead become deeper and skin thickens. This typical feature suggests leonine faces. Eyebrow become thick and last, or in other words, you can say there is the medrosis. Earlobes are thickened, nose misshapen and collapse due to loss of nasal spine. Voice become hoarse, and upper incisor teeth loosen or fall out. Skin of the leg may become ectotic and thickened ulcer may form on legs, leads ultimately to stocking anesthesia. Lepromatous deposits in the eye leads to keratitis, iridocyclitis and iris atrophy. Testicular atrophy leads to sterility, impotence and gynecomastia. This is an example of leonine faces in lepromatous leprosy. The features you can see here, there are thickening of skin of forehead, especially in the area of lines. There is thickening of skin of eyebrow with loss of eyebrow, thickening of lobes of hair. You can see the misshapen nose. This is typical lesion of lepromatous leprosy. This is another example of lepromatous leprosy. Here, dorsal surface of hands are involved. You can see the nodule with erythema. There is also anesthesia of involved area. In picture A, you can see the involvement of hand. The features in hand are crooked or short fingers, thin or dystrophic nails. These are the common symptoms noted in the hand. Moreover, on X-ray you can see the osteoporosis and osteolytic lesion and compression fracture. In picture B, you can see the collapse of the nose after involvement of nasal spines by the leprosy. Borderline leprosy is a third type of leprosy. Lesions are intermediate between two already mentioned type of leprosy. They may take shape of macule, plaque, annular, lesion, and bizarre shaped band. Plaque with punched out appearance are characteristics of middle of the spectrum. Like tuberculoid lesion are few and drier, have more hair loss and hydrosis and more insensitive. Like lepromatous, nerves are thickened, non-functional. Neuronal septum appear preceded by skill lesion by as much as 8 years. This is an example of borderline type of leprosy. The lesions of this type of leprosy may be macule, plaque, annular or bizarre shaped band. These plaques are usually punched out in appearance. Pure neurotic leprosy. It is the fifth type of leprosy. Here, these lesions are characterized by asymmetrical involvement of peripheral nerves, trunk, and no visible skin lesion. Histology shows all type of leprosy. 10 to 15 percentage of cases of leprosy are seen in India and Nepal. Thank you very much. Stay connected and subscribe my YouTube channel.